Amen.
Good afternoon, Mariam and Tasir. We're just waiting, and Mugisha also. Thank you for joining. I'm just waiting for a few more people to join, including our facilitators. Then we will start the consultation meeting at the top of the hour. Good afternoon, Ahmed. Ahmed, please check if you're able to unmute. Oh, check, I've made you co-host. So just try and unmute now. Oh, great. Good afternoon.
Hi, Mercy. Good afternoon. How are you?
I'm fine, thank you. How are you?
Yeah, great. Thank you.
It's good that you have joined. Let's wait for Almugira and also Jamie. And
Sure.
we wait for a few more other people to join, and then we can start.
Yeah, that's fine. Thank you.
All right. Good afternoon, everyone. Thank you for joining our meeting today. We're just waiting for a few more people to join. Maybe you can give up like 5 more minutes, and then we can start as I set up the interpretation. Good afternoon, everyone. Welcome to our Arabic Africa chapter consultations. I'm Masi Wanjala. I'm the Deputy Executive Coordinator, AfroPHC. And I'd like to hand you over today to your facilitators, who are Dr. Mugira Alamin and Ahmed Salam, who will facilitate the meeting today. So please go ahead and introduce yourselves and set the agenda.
Hello, everyone. I'm Dr. Al-Mughir Al-Amin Jadasid. I'm consultant public health professional, and I'm working with National Health Insurance Fund in Sudan. I'm very happy today to facilitate this event together with my colleague Ahmed Salam from Egypt. And we are so glad on behalf of AfroPHC Executive Board to welcome you all at this forum in order to widen the discussion around many issues that is related to primary healthcare in our Africa in general and in our region in particular. By our region, I mean the Arab region, and we are very glad to have these chapters, which we will talk about in a minute. AfroPHC, as you know, is a forum that is gathering all those are interested in primary healthcare in general, including diversity of or wide spectrum of professions in public health sector, including ministries of health, academia, patient advocacy groups, students from different disciplines, and so on, and etc. So we really we are happy that we have this forum in Africa that catering and advocating for the primary healthcare, especially those in the front line from health workers and universal health coverage. And you know that now universal health coverage is one of the trends that is globe-wide people are talking about because it is one of the things that included within the SDGs that all nations or all countries should have this line or this trend to be the most appropriate way for delivering healthcare to people, especially those in primary healthcare. AfroPHC is working in this area and was engaging in many events and held many or a lot of workshops in a series that all aimed at formulating a policy framework that advocating for primary health care and in universal health coverage in particular. So this event today is one of these series of events in this regard. And today we have many agenda, including some introductions, and also we will have like this like introduction to AfroPHC and chapter discussion on what are the challenges of primary health care in our region. And this will be a presentation, and we will have this presentation next. Then we will have a review of AfroPHC policy framework. We will have a discussion on this, the draft policy framework, what we like and what we don't like, and what are our suggestions. Then we have a discussion on how we take AfroPHC forward. So this mainly our discussion mainly will concentrate on this, and the first presentation will be about what are the challenges of primary healthcare in our region. And by the way, AfroPHC now have or has these chapters in Central, Western, Eastern, and in the northern part, which is Arab country and Portuguese. So this in order to delegating some authorities to the region, because we know that these regions, each region has its own challenges and issues, and this is why we concentrate. We go in this way to have like chapters in each region of our. Although we know that all of us share the same challenges and issues regarding health of Africans, but each region has its particular issues. This is why AfroPHC goes in this direction, to have chapters in each chapter in each region. Today we have the Arab region. I think this is the first event to be held in this period, and also it is like consultation on the way for having an endorsed
sorry
policy
to cut you short, Al-Mughira. Maybe just to save a little time, I have a presentation that will cover most of what you have mentioned. So probably we could just move to introductions of everyone who is here with us today, so that we can know who's in the room. Just names and your background or your discipline. And you maybe could also tell us whether or not you're a member of AfroPHC.
Thanks, Mercy, for the introduction, and highly appreciate Dr. Al-Mughira for a comprehensive overview and introduction. It's my pleasure to be with you. My name is Ahmed Gamal Salam. I'm a nurse from Egypt. I'm so proud to be a nurse. I'm a nurse educator, and currently I'm ANSI co-founder, African Novice Nurse and Student Initiative co-founder, and currently in the advisory board member of AfroPHC. And highly appreciate your attendance. Today we have Jamie Colty, Professor Shapir as usual, and Amani, Daniel, Kareem, Nahid, Rania, Rawia, Taysir, Mariam, and also as well as Dr. Mughira mentioned that we have this Arabic channel, and feel free to speak in Arabic language. So you are most welcome to speak if you would like to speak in Arabic, and we will translate for you as well. And if you have any challenges in any statements or discussions, just raise your hand or write it down on the chat box in Arabic language or English, and also we will support you. I would like to invite all of you to introduce yourself, your background. We are a 1MDT multidisciplinary team focusing on improving the primary health care and to reach the universal health coverage in Africa. So please introduce yourself and feel free to do this. You can go through like alphabetically if you would like. You can start with Dr. Amani. Could you please introduce yourself? Amani, can you hear me? Okay, next, Daniel. Daniel, if you can hear me, if you would like to introduce yourself.
Okay,
Yes.
Good afternoon, everyone. My name is Daniel Asipala. I'm a senior lecturer at the University of Namibia. I'm a nurse educator. My interest is primary care. Yeah, basically that I'm a doctoral candidate with the University of Stellenbosch in Cape Town. And my research is about developing a framework for task shifting of mental health services in primary healthcare services in Commerce region, Namibia. Yeah, and I publish also with the African Journal of Primary Healthcare in South Africa. Yeah, that is me. And I'm also a reviewer. And I'm happy to join the webinar.
That's great. Thanks, Daniel.
Hello.
And welcome to our webinar.
Okay.
Yes.
Now I can introduce myself. My name is Professor Amani Sharif.
Yes,
I'm the Dean Faculty of Pharmacy, Lazar University, and I am the Vice President of Pan-African University as well. And I'm the Regional Coordinator for Association of African Universities for North Africa. And I'm consultant in WHO. And I'm happy to be with you today and hope we can conclude a promising policy for Africa Health. Thank you.
Thank you so much, Professor Amani, and happy to welcome you to our webinar today. Next in alphabetical order is Karim. Karim or Karim? Because in Arabic we have two names, Karim and Karim as well. If you can hear me, you can, would like to introduce yourself. In the chat box, I think you write something. Hello, everyone. Hope you are all well. This is Karim or Karim Arif from Malawi. I won't be able to mute as I'm up. I'm in the hospital in the wards. Okay, that's fine. Thanks for joining us. And Karim, by the way, your name is mostly Arabic, so happy to welcome you from Malawi. Next, alphabetical, we have Nahid. Nahid, if you can hear me, can you please introduce yourself, your background, any interest in primary health care? I'm not sure, Mercy, can everyone unmute himself or herself or no?
Yes, everyone has permission to unmute now.
Okay, that's great. So Nahid, if you can hear me, if you would like to introduce yourself through the microphone, it's fine, or even go through the chat box. Then we have Professor Amani El Sharif. Please, Dr. Amani. This duplicated. Sorry, Dr. Amani, you done before. Then we have Professor Joma.
Yes, good afternoon, everybody. I'm Professor Goma. I'm Egyptian, but I'm working in Ahmad Bello University. I'm Professor in Nursing Science Department, and I'm the postgraduate program coordinator in the Department of Nursing Science. And happy to be here with you. Thank you. Over. Okay,
You're most welcome, Professor Joma. Thanks for joining us.
Internet.
Then we have Rania. Would you like to introduce yourself? Are you still muted? If you would like to write it down in the chat box, feel free, please.
Okay.
Oh, yes, now we can hear you.
Rania Amara. I am PhD student in Alexandria University, chemistry department. I specialize in bioinorganic chemistry and material science in solid state especially. Solid state physics with bioinorganic chemistry.
Yeah, that's great. Thanks, Rania. And you see, this is a multidisciplinary approach webinar, so you're most welcome.
Multidisciplinary chemistry, physics, biology, and the computational chemistry also.
Yeah, that's great. And you know, that's the sustainable development goals is something comprehensive, and we need even the social determinants of health as well. We need every single specialty related to the healthcare professions to take it forward. Thanks so much for joining us today, Rani. Then alphabetically, we have Rawia Kamal.
Good afternoon, everyone. I am Rawia Kamaluddin from Sudan. I am proud to be a medical laboratory specialist in the education basis, but currently I'm working as a healthcare management consultant, supporting, currently collaborating with the WHO and the Ministry of Health Sudan in capacity building programs, especially in the health systems strengthening. And also I'm a project manager, healthcare project manager. Thank you very much for being. I'm very proud to be with you today.
Most welcome, Rawi, and also we are happy to welcome you today in our webinar. Thanks, Rawi. And then we have Taysir Mitwali.
السلام عليكم.
وعليكم السلام ورحمة الله وبركاته.
أنا أتكلم بالعربي ولا إنجليش؟
يا أهلا وسهلا، إحنا تحت أمرك، تفضلي. وأنا يعني اللغة اللي حضرتك تفضليها تفضلي.
أوكي، أنا دكتورة تيسير متولي، أستاذ مساعد في كلية الطب جامعة السويس ورئيس القسم، وعضو في نقابة أطباء السويس، رئيس رابطة أطباء الأسرة بالسويس.
يا أهلا وسهلا دكتورة تيسير، منورانا. Thank you so much for joining us, Dr. Taysir, for joining us today in our webinar from Egypt. Then we have
Ahmed, you'll have to help with Ahmed. Just a request, you'll have to help with Arabic translation.
Yep.
We only have French translation today, so.
Okay. I am assistant professor of family
thank you, Taysir.
So, and head of the Association of Family Physicians in the Medical Syndicate and so is Governorate in Egypt. Thanks a lot.
Yeah, that's great. Thanks again, Dr. Taysir, and welcome to our webinar today. Then we have Jan Theophil. I'm not very good in pronunciation of the names. Jan, can you hear me? If you'd like to introduce yourself, please go ahead. Yes? Yes, Jan? Your microphone is unmuted, but still can't hear you. Anyway, we can use the chat box as well.
Okay, thanks.
Great, thanks, Jan. And also we have, as a co-host, we have Professor Shapir and Jamie and Mercy as well. She introduced herself. So Jamie and Professor Shapir, if you'd like these two introduce yourselves to our participants today, it will be appreciated.
Perhaps Jamie go first and then I'll do next. Go next.
Okay, hi everyone. My name is Jamie Colletti. I am a medical doctor from South Africa and part of the AfroPHC executive coordinating team. I'll be taking the minutes for this meeting. Thank you so much for having me here, and I'm looking forward to hearing about the different challenges in the region. Thank you.
That's great. Thanks, Jamie. Dr. Shapir.
Assalamu alaikum, everyone. It's great to be here. My name is Shapir Musa. I'm sorry I'm driving and trying to multitask, but as a family physician, I work in Johannesburg in the which is a large metro in South Africa. I am the executive coordinator of the African Forum for Primary Healthcare and very pleased to be part of this discussion in Arabic North Africa, and also part of Bonka, at the member of large Bonka World. So great to be here. Inshallah, I hope it was a productive discussion, and I'll be sitting in the background, but listening intently. Jazakallah khair. Assalamu alaikum.
Alaikum salam. Thank you so much, Professor Shabir, for introducing yourself and for your continuous support for AfroPHC to take forward. We have on the chat box, Yan said, hello, I'm Yan, medical student from University of Rwanda. I'm happy to be here learning a lot from you, and also we will learn from you, Yan, because this is like a discussion and we need to change our experience and passion as well. You still have not enough experience, but you now currently have passion to take it forward. Thanks everyone to join us today to speak about primary healthcare and its role in taking universal health coverage forward. As we are focusing on SDGs 2030, Sustainable Development Goals, please don't forget our Africa Agenda 2063. It's my pleasure to give the floor to Mercy to go through the challenges regarding primary healthcare in the region, and then we can review the policy framework and also to continue our discussion. Mercy, the floor is yours.
Thank you very much, Ahmed. It is good to see that there's a lot of experience and also different disciplines around the room. So I'm really looking forward to our discussion. I'm really looking forward to our discussion today. So I'm going to start us off with a bit of an introduction to AfroPHC, so that if in case you're not familiar with what AfroPHC is and what we do, you can be more familiar with that. Then I'm also going to talk about chapter consultations. Why are we here today and what exactly are we aiming to achieve? So in terms of the agenda, as Al-Mughira had mentioned when we were starting, we are basically going to go through AfroPHC and what the chapters are, what they aim to accomplish. Then from there, we are going to have a round of discussion facilitated by Ahmed and Al-Mughira on the challenges that primary healthcare is facing in the region. And then from there, we are going to go through a review of the AfroPHC policy framework, where Jamie Colity is going to make a presentation on the call to Africa. And then we are going to discuss the draft policy framework, which I'm hoping we have had a time to at least scan through or read through, so that we can be able to have good and meaningful discussion today. And then after that, we will have a conclusion on how we take AfroPHC forward in the region. So just a bit of background on AfroPHC and where it started. It started as an idea during a Wonk Africa conference in June 2019 in Kampala, where there was a suggestion that since there's a European forum on primary healthcare and they're really doing a lot to advance primary healthcare in the European region, probably Africa should also think of having such a forum. So the idea began there, and during the AfriPen August 2019 conference in Nairobi, it was further developed by people like Bongi Sibanda and Champion Nyoni, who happened also who are major part of the AfroPHC leadership came together and decided to take the idea forward. Then in 2019, during the UHC declaration in September, a lot of organizations came forth to support the idea and also to support the starting of the Africa Forum for Primary Healthcare. So the initial pitch, this is what it looked like. Why do we want to have an Africa Forum for Primary Healthcare? So it was because we as healthcare workers on the front lines of Africa primary healthcare services in health systems of Africa and supporters of the primary healthcare approach are committed to achieving universal health coverage in Africa. And however, it is very easy for UHC to be seen as a financial solution without the required reform in primary care service delivery, the centrality of PHC to UHC efforts may become lip service, especially when frontline primary care workers' voices are ignored in Africa. So you see the initial, one of the main initial points to start of starting AfroPHC was so that the frontline primary care worker voices can be heard in forums such as the one we're having today. And we plan to bring together the leadership of all healthcare workers at the coalface in African primary care, and to ensure that we all have a voice in policy on primary care and primary healthcare in Africa. And we hope to develop an African forum for primary healthcare as the voice of primary care and the primary healthcare team and its supporters, sharing and supporting each other in advocating for PHC. So this is how, sorry,
I'm sorry to interrupt you. I don't know if I'm the only one, but I can't see your slides. It's still on the, for me, on slide, the last slide that says join AfroPHC with all the thank yous.
All right. I don't know. What slides are you seeing now?
I'm seeing it's a PowerPoint with 8 slides. It's the final slide with all of the thank you.
Oh, sorry. Let me just change that.
Thanks, no problem.
Let me just change that. Sorry. Let me reshare. Here I was going on thinking everyone is seeing what I'm seeing. Thank you for that, Jamie.
Yes, perfect. Yeah, there we go. We can see. Thanks.
Okay. Thank you. So this was the initial pitch, basically surrounding the idea that it is important to hear the voice of the frontline primary healthcare workers, to hear their challenges, and to involve them when you're drafting policy in primary healthcare and any kind of efforts you're making towards universal health coverage in Africa. So there was an initial workshop in 2020 with introductions of the people who had come together to form Africa Forum of Primary Healthcare. And in September 2020 is when there was a first joint exercise, a launch workshop for AfroPHC, where they came up with a statement and key principles of AfroPHC and how AfroPHC would work. Then later on, there was a statement in 10th December during the AfroPHC for UHC workshop on reflections and a statement on workforce issues in primary healthcare in Africa. So during launch now in 2021, there was an annual general meeting during which now the structure for AfroPHC began to form, with members voting in a 9-person executive board from various countries in Africa. And as you can see from the list of people who made up that initial board, it had quite a lot of diversity in terms of discipline and also in terms of country of origin, and also in terms of also age and experience. So later on, we had 3 more members co-opted to join that board. That was, these ones were not elected, they were co-opted. That is Champion, Marie Claire, and Tolu, who came in to make up the board. So this was how AfroPHC started and the structure that it began with. So now I'm going to go through AfroPHC as it is structured and organized now, and the activities that AfroPHC has been involved in from that point forward, led by the executive coordinator, Prof. Shabir Musa. So in terms of stakeholder engagement, AfroPHC to date has managed to have 31 supporting organizations, and an advisory board has been set up, drawing experience and people and leadership from the supporting organizations as well. And there have been engagement with the WHO Civil Society Commission to try and improve engagements with WHO engagements with civil society, and AfroPHC has been a part of that. We have the AfroPHC Youth Hub, which has is an arm aimed at improving engagement with the young leaders in Africa. So we have individual members in the Youth Hub who are former student leaders. And we also have organizations such as the African Health Students Summit as part of the AfroPHC Youth Hub. Then we also have policy workshops that occur the second Tuesday of every month. Last year, we ran 10 workshops, and these were the titles of the workshop. You can go to the page and check the topics which we discussed. And also 2022, we have continued with a series of workshops. We have done practice models, rehab in PHC, pharmacists. Just last month, we had one on, we have had one on One Health and also environmental health, which was quite interesting. Considering environmental health is not that commonly, environmental health and One Health is not that commonly discussed in Africa. And we are also having one coming up this month on women next month on women, the role of women in primary healthcare in Africa. So you're all welcome to get involved in the policy workshops, and also as potential speakers, that's an opportunity. Then out of these policy workshops, the contributions that the various members have been making was birthed the policy document, Building the PHC Team for UHC in Africa, led by Prof. Shabir Musa, who drafted the document, so that looking at the different contexts in Africa and the different challenges, it was important to come up with an African primary healthcare team that is effective. So that is the document that we will be discussing today. So I hope you have had the chance to look at that. Then in terms of training, we have three ongoing projects. One is the collaboration with Amref Africa on leadership management and governance for health system strengthening course, where we have a monthly meeting for all the students who have enrolled and are in progress for 2022 cohort. So we usually have a discussion every month. Then we have the clinical CPDs that we have every single week for clinical capacity building. And also the curriculum, we are in the process of developing a curriculum for a 2-year online clinical postgraduate diploma in family medicine for the primary healthcare workers in Africa. It is not just for doctors, it is also for nurses and clinical officers. Then in terms of research, we have an ongoing mentorship program where we have people who have enrolled as young researchers or researchers who are just starting, with more seasoned researchers and published researchers, mentoring them in developing a concept note, a proposal, and eventually something that they can publish or even get a grant on. So that is ongoing. So far, we have had about 19 researchers submitting concept notes for mentorship, and the program is ongoing. Then we also, so we meet the first Tuesday of every month to develop capacity and also resource share. We are also involved in a project to form what is called the Africa Population Cohort Consortium. It is a collaboration between different organizations, and AfroPHC is one of those organizations. And so we received a grant to develop this consortium. Then in terms of communication, we mostly use the website where we post news and have posted everything about AfroPHC activities. There's a monthly newsletter and also emails. I think if you have registered as an AfroPHC member and joined the Google group, then you will find that you receive these emails. Please mute your microphones if you're not speaking. Someone has. So that is an overview on AfroPHC activities. Then moving on to administration, AfroPHC is led by the executive coordinator, who is Prof. Shabir Musa, and recently me as his deputy. And we have what is called the Executive Coordination Team, which is a team of young volunteers and leaders who are helping to oversee most of the activities that you have seen. We have Senkire Kumi on research. We have Eli Bajo on CPD. We have Jomi Koloti leading the clinical, the development of the curriculum for the postgraduate diploma. So it is basically a team of young people who have volunteered to support the executive coordinator in various tasks and functions. We also have a strategic and operational plan, which you can find on our website. And so you know, we are a registered NGO in South Africa, a registered and legal entity, and most of our expenses and are just, as at now, are just around managing the website, managing Zoom and French translation for our different meetings. So for each of our meetings, we try to have a French translator for all the Francophone countries that we have. Then coming down to one of the main reasons why we are here today, we received recently a PHCPI micro grant to develop a policy framework around building the PHC teams for UHC in Africa, focusing mainly on how do we build an effective team. So that's the amount of the grant that you received. You can read more about it on the website. And in terms of our consultation today, we want to build chapters across Africa. That is one of the major reasons why we are here today, because we realized it is important to have the voice of the local voice heard and also the regional voice heard, and also so that we can be able to come up with regional and also local projects that are context specific and relevant to different contexts. So we have the regional chapters which were developed, and we have regional WhatsApp groups for communication with the various regional chapters. And as facilitators for those chapters, we have members of either the advisory board and also the executive board leading discussions in that WhatsApp group, and will also be leading discussion in during our chapter consultation. But so that's how the chapter meetings began. But now with the grant, it has been subsumed into the consultation meetings around the policy framework. So basically, the chapter consultations are about looking at challenges of PHC in the region, reviewing the draft policy framework so that we can get the feel and also the opinion and input of the people working on the ground. Then also it is important to see how we as AfroPHC, as members, and also from a regional perspective, how can AfroPHC move forward? And more importantly, how can we come up with an interim regional task team that can help us achieve conduct various activities at the regional level? And with that, I would like to hand over back to Al-Mughira and Ahmed to move on with the discussion around the challenges that we have within the region. Thank you very much. And also feel free to ask questions if you need any clarification on the presentation I've just made as well.
Thank you very much, Mercy, for this nice tourism around AfroPHC and the chapters in each region of Africa and the reasons why we are here today. So now we open the floor for discussion. If you have any comment, any clarification, and any comments regarding this presentation, you are welcome.
Thanks, Dr. Mughira. I highly appreciate the diversity of this group. We are 18 from different countries, mostly representing North Africa. Most Arabic countries start from on the right side in the map: Egypt, then Libya, Tunisia, Algeria, Morocco, so Sudan, Somalia. So we have, and as well in some other countries attending today, like Rwanda, Namibia, and other countries. Sorry if I forget other countries, but my point here that we have like a fruitful group and with diversity of experience. So every single one of us has his own valid points. So please feel free to share from your point of view the challenges that you faced us as a region and locally as well in your country. What are the most common challenges that you feel that it's like it's a matter We need to discuss it. We need to share our experience, how to overcome this kind of challenges. So please feel free to share it. If you can speak, if you can open your microphone, camera. If you can't, just write it down on the chat box and we can read for you as well. Who would like to start? You have Daniel, Gracie, Mariam, Nahid, Nwapufu, Professor Goma, Rania, Rawia, Sakina, Sinkaya, Taysir. So please feel free. It's just like a discussion. From your point of view, what are the challenges of primary healthcare in our region? So I have a question before that, and please, I need answer from each one. Do we have challenges in terms of primary healthcare in our countries? Do we have or no? Professor Goma said on the chat box, yes, we have a lot. So, like what? Dr. Professor Goma, please, like what? From your point of view, what are the challenges that we have? And Rania Amara said also, yes, we have. So Rania, from your point of view, what are these challenges that we have from your point of view? Yes, Dr. Taysir Metwali, yes, please go ahead. You're still muted, please. If you unmute yourself, please, to be able to hear your voice. Taysir Metwali. Going back to the chat box, we have here, let me read. Professor Goma said that, sorry, I'm outside, so noisy. That's fine. The system itself and the policy. So from the point of view of Professor Goma, that's one of the challenges that we have, the system, the healthcare system, maybe in the national healthcare system in our countries, that we need to improve it, and other point, the policy that regulates and manage the primary healthcare. That's fine. Then we have Rawia Kamal said that political instability, financial issues, employee turnaround. I think these three valid points, the challenges, obstacles. We have the political instability and political challenges, financial issues, and consider the financial support for the healthcare system itself, and employee turnaround, and not only employee turnaround, maybe the human resource management in the healthcare system itself. Thanks, Rawia, so much for sharing this kind of challenges. Taysir Metwali, she said, cannot unmute. So please, Mercy, can you help Taysir Metwali to be unmute? We need to hear her voice, please.
Apologies, I think I prevented that, but now everyone can unmute.
Okay. Yes, yes.
Yes.
Thanks, sir.
Yes, we can hear you well.
Okay.
Yes, please. Yeah.
I think we have a problem that our society, our people in Egypt don't understand what is the meaning of family physician, what is the role of the primary health care. They go to ask about the doctor for pediatric or for women health, like that, okay? So the first step, we need to make an effort to make all people understand what is the primary health care, what is the rule, the different rules of the family physician in the primary health care. This is one. The second point, that we need to empower our activity in the prevention, making screening for different age groups, making important health education material. This is unique role for the family physician, more than other specialties. All the specialties can manage patients, but the one who can make prevention by health education and by asking for screening investigation is the family physician. I think these 2 points are so important in the coming years. Thanks a lot.
Yes, definitely. Thank you so much, Dr. Taisi, for raising this 2 valid points as a challenges that we have in our local communities. One, population awareness regarding the importance and the mechanism of primary healthcare system, and as well the prevention and health promotion in general, and focusing on preventing the disease more than, or as well, we focusing on treating the disease itself. I just have a question or clarification, Dr. Taisir. In terms of the population awareness and the referral system, that me as a person prefer to go directly to the specialty or the secondary healthcare level, rather than going to the primary healthcare facility. And how can we change this mindset of the population that we have to go first for the primary healthcare, then we have like a referral system to the secondary healthcare? How can we increase the awareness of that point?
It started already in the governors with which the insurance system start to do, but still the people in this governorate, not all people understand what is the benefit of going to the primary health care. There is smiling system, there is improvement in the services, but still need satisfaction to be the first point of the patients, not to go and come again the next day and to take their service in the same day, to do that, as I said before, screening investigation to improve the health. We need the family physician to be trained enough for various specialties at the level of the primary health care to be accepted and to have satisfaction of their patients. Sure, we need more challenges to be better in the coming years, inshallah. And the referral system still not ready enough in the all governments in Egypt.
Yeah, definitely. Hopefully, that it will be soon and continuously. There is a sustainability of the improvement of primary healthcare system and referral system to the secondary healthcare. Thank you so much, Dr. Taisir, for this valid points and fruitful discussion as well regarding the challenges that we have and how we can overcome these kind of challenges. I'm still inviting all of you to share your point of view regionally and locally, point of view regarding the challenges of primary healthcare in our communities. Any other one would like to share his or her own experience? Please raise your hand and open your microphone and let us discuss. Let me go back to the chat box. Sorry if I missed something. Professor Goma said that the process of delivering the care, yep, definitely. Rania Kamal said that immigration, yeah, in terms of the human resources themselves transferring from country to country. Professor Goma again said that the working environment, yes, definitely. The facility and resources in the primary healthcare facilities and the human conditions. Totally agree with you. Rania Amara said again, in countryside, some medical services not available. The shortage, yes, totally agree with you. The shortage of equipments that is one of the major challenges that we might have. Professor Goma again said that the PHC is low resources area are highly vulnerable. Totally agree with you. The remote area in some countries really needs to be considered as one of the major challenges that we have. Then Rania Amara said that the problem is, the problems in feeding, and yes, totally agree. The nutrition in general. Professor Goma again said that the rural areas and human resources shortage, yes, totally agree. The people lack of information and economic burdens, yes, definitely. Sometimes the transportation itself, yes. So this is the reason why we need to focus and think in the multi-sectoral approach, not only multidisciplinary approach as a healthcare system, or, sorry, as a healthcare provider. We have nurses, physicians, pharmacists, dentists, many other healthcare professions, but it's not enough. We need to go beyond the healthcare system. As Professor Goma mentioned, sometimes in the transportation, we need to speak and discuss and raise the discussions with the multi-sectoral approach, with other ministries and departments in our countries as well. Mercy, yeah, Mercy sent a welcoming message. And again, the question, what are the challenges of primary healthcare in your region and in local area as well? Umneya said that unavailability of medical cadre professionals at the rural areas is one of the big problems. Totally agree with you, Umneya. Highly appreciate Professor Goma and Rania Imara conversation on the chat box. Really, it's fruitful. Thanks, Umneya, for sharing that. Please feel free to raise your hand, open your microphone, discuss the challenges that we have. We need to address the challenges and the problems before we think about solution. Coming back to Dr. Taysir, please, you mentioned a very valid point, the prevention and promotion. I just have a doubt regarding you mentioned the family physician, and I would like to add nurses working in primary and community nurses, pharmacists working in primary healthcare, and all the multidisciplinary team working in primary healthcare. You mentioned prevention and promotion. How can we empower the primary healthcare workforce to support them and empower them to prevent the disease and focusing on prevention? From your point of view, Dr. Taysir, please.
I think it's already in the centers, which is already prepared for the insurance to be role model. All the team members will act for their rules, like the nurses can make health education. They take many information from the patient, make share in counseling, as in family planning, for example. The pharmacist can help in choosing the actual dose or return to the doctor if there is a defect or missing drugs in the pharmacy. The family physician will have a family file, all the information, family history, past history, drug allergy. He can deal with the patient and recommend the screening tests or investigation or imaging that the patients need for. For example, if we talk about a diabetic patient, we must have a lot of information about him, all the investigation done to be recorded in the family file. As my doctor, our thesis was about diabetic foot. So the screening of diabetic foot is an important issue. The nurse can help in the screening, investigation or exam of the foot. The notes can be recorded in the family file. Then improvement of the small or teeny problems like tinnitus or dryness, calluses, which can be dealt with and managed early. It will make a big difference, will provide us healthy patients, not to go to ulcer or amputation. So this is a good rule of the primary health care, for example. So I am with you that all the team can help to improve the health and to make prevention and improve the lifestyle of the patients.
Thank you so much, Dr. Taysir, for raising the importance of working as a team, and each one in the team know exactly his or her role, empowering the healthcare professionals, who, dealing with them as a resource, as a valuable resource, as a human resources, I think it's a very, very valid point, and it will lead to build a strong primary health care system as well. I would like to transfer it to my dear colleague, Dr. Al-Mughira. So please, Dr. Al-Mughira, the floor is yours, and you can continue leading the discussion. Thank you.
Thank you very, very much, Dr. Ahmed Salam, for this nice facilitation and enriching the discussion. I would like just to add that what is said by all participants is very, very valid, and really they touch all the important issues that are related to the problems or challenges in our region. But I would like, when I come across these challenges, I saw them all are fitting the 6 building blocks. People are talking about the healthcare service delivery. People are talking about the workforce in healthcare in our system or in our region. Also, they talk about the financing of healthcare in our system. All these are the 6 the building blocks of the health system in our region. 2 points I think that are missed, which are the governance. I think also the governance in our region needs to be enforced. One of the challenges in our region. Another thing is that the one of the most important things also which I missed in the discussion is the information system. Also, we do have many challenges regarding the information from the start, from the capturing of this, these information up to the collection to interpretation and how to make use of this information. If there are there are many reports are delayed, many reports are missing important things. This is from practical point of view, because we work in this region and we held many supervisory visits to the field, starting from health centers up to the upper level regarding the locality, the state. This is in Sudan, and I'm sure these challenges also are there in our other countries in our region. So I would like to add this governance and information. And you know that now information are the backbone of all the planning processes as far as the health system is concerned. Thank you, Ahmed, and I think Mercy has something to say. Then we'll see how time is going, in order, because we have Jami also has another presentation. Mercy, the floor is yours.
Thank you so much, Al-Mughira. Mine is actually just out of curiosity. If Omnia Hassan could unmute and explain further, he has made a few points there that I would really like to hear more about. One is he's mentioned that there's an absence of primary healthcare professional training, and also that training schools in some countries led to the closure of PHC centers. I think those are that's a challenge that I would really like to understand more about. Omnia Hassan, if you could maybe unmute, introduce yourself, which country, and just expound further on that challenge.
Okay, good afternoon, everybody. My name is, actually, I'm joining the meeting with somebody else's phone. My name is Amal Abul Qasim, and I am from Sudan. I'm a public health specialist. I've been working within the humanitarian sector for more than 15 years. I have toured all over Sudan and see how the primary healthcare centers and system been working in Sudan. In the past, and Dr. Al-Mughira can agree on this. In the past, it was one of the strongest systems working. But now there have been some schools over Sudan training the public health professionals for leading the centers. But now these centers, these schools has been closed during the past regime, and we lost many of the professional cadres in this. If you go in some areas, you will find that the primary health care system is center in the rural areas is being led by for example, a midwife or a untrained nurse. So, but in the past, it was a primary health care professional, somebody who can do all the medical investigations, start the referral system and the availability of drugs and all of this. But this problem really and truly had led to lack of cadres that can work on at the centers, at the health centers, and you can see that the health centers are almost closed or just being professional or specified in, for example, in reproductive health, antenatal care, and all of this because of the availability of some midwives at the area. This is my point, and this, I think, one of the biggest challenge for the primary health care system in our country in Sudan. Thank you very much.
Thank you very much, Omnia, for these remarks. And as you said, the problems with the primary healthcare usually it is related to multi-dimensions problems, and as you said, sometimes the policymakers, the leaders, do something that may violate the process of delivering the healthcare system, especially in the primary healthcare, and we saw in the past regime many things occurred, like closing these schools which were very productive in generating health cadre for primary healthcare. Thank you very much. Mercy, still you are raising your hand.
Yes, again, just to seek a bit of clarification from another comment I've seen in the chat from Rania on the issues of feeding, which I'm assuming is nutrition. If Rania, you could just explain a little bit more about that. Rania Emara, if you could just unmute and explain a little bit more about that challenge.
You say Rania or Rawia?
Oh, Rania with
okay.
N.
Because we have Rania and
Rawia and Rania.
Yeah.
Or you can just type in the chat as well, so that we can understand a bit more about it.
Rania, the floor is yours, if you can. Yes. Mute yourself and start talking. Or if you have some challenges, you can write on the chat. Rania, are you there?
I think not. Maybe we can just move on.
Okay. I really, again, I would like to appreciate the diversity in this group, and we saw many people in the different disciplines: nursing, midwifery, pharmacy. Some are students, some are professors. And I think this is very nice, and this is very promising point that we can lead our the AfroPHC in our region in the Arab chapter, or the Arabic chapter. As Ahmed said in the start, this is highly appreciated, and we do consider this as an asset for our region. And this is very promising, really, in order to lead or to improve the system in our region. Okay. Ahmed, the floor is yours again, if you have any.
Yes, thanks, Dr. Al-Mughira, for facilitating the discussion and really raised the main valid points as well. Me coming back to the chat box, if we missed any, I think Professor Goma said that, Dr. Taysir said that we can use access information management in our PHC centers to overcome need for expensive IT programs, and we apply it in Suez, Egypt before it's available, easy, quick, cheap. Actually thinking out of the box to solve our problems, I think it's a very, very important as well. And we need to teach the next generations and the youth in that. For example, the statement mentioned by Dr. Taysir that some available solutions in IT and that. Dr. Taysir, would you like to please open your microphone and let us know more about this kind of experience? Because this is one of the major challenges that we have, the medical records, electronic medical records, and healthcare information system management in general. So if you have any experience or something would you like to share, please do it.
Yes, sir. I was a manager of primary health care in Amr village. It's a rural area in South Governorate, Egypt. This center is called the family primary health care. It's related to the Suez Canal University, not governmental. Okay. And monthly, we need to prepare a report and introduce it to the administration in the family medicine department in Ismailia. So I learned my employees how to deal with the Access program. It's one of the Microsoft Office programs like Excel and Word and PowerPoint. It was very simple, and in the end of the month, we can calculate how many patients we deal with, if what percentage of sex, male or females, if there is children, specialty or the specific like is the problems, women health or pediatric or ENT or psychiatry or dermatology. You know, if as we are a family physician, we meet different situations and complaints. So we can make in the end of the month report with all the details. Also, we can document the doctor who was counseling these patients. The family file was recorded, the number of the family file, the name of the patient, its age, the problem, if he has hypertension, diabetes. If we can add also results of investigation. It can be more advanced, but I didn't make more effort, but we can make it. We have resources like a computer in the lab and other in the clinic or in the information room. We can make also like connection between different computers and find in the end a report with all the information related to the patient. It's so easy, not expensive. We not need to buy a very expensive program to make a network primary health care.
Really, I very appreciating that. It's a very, very applicable and using, you know, this is the wisdom of using the available resources that we have.
Just the monthly and the yearly report, it's so easy to calculate the prevalence of disease or the complaints which you faced in this area.
So it could be used in research activities as well after ethical consideration as well. So we have data, we can transfer it to information, and then we can take some decisions to maximize something. We need to add more clinics in that specialty or something else. Yeah.
Yes, we can also, if you recommend the medication with the patients take, to make assessment if this is good or there is interaction between the many drugs that they take, especially those with chronic illnesses, the diabetic and hypertensive patients. When you see the medication, you can make reassessment for that. If you make an investigation, you can discover another problem, you need to add another medication. In the end, you can find a report with all what you need.
And it will lead to that the continuity of care that we need to be the continuity of care, one of the major principles that we always talk about, the continuity of care. I think it will help as well.
If you talk for the hypertensive patients, like what you meet in the previous year, you can make a screening for their families or diabetic patients. Or ask for how many of these patients are controlled, or how many of them have an annual investigation. It can help in many important activities.
Yeah, definitely. Thank you so much, Dr. Zaisir, for raising that. Definitely, using a national secured IT or network is something valuable, and it's needed in our countries. But thinking out of the box, critical thinking, think globally and act locally according to our valuable or available resources, it's something crucial and should be raised and spread in our local countries, especially in Africa. We need, and this is one of the main objectives of this discussion of the webinar, to exchange the experiences that we have in our local communities. Again, appreciate it. Thank you so much, Dr. Taisir, for raising
Thank you. Thank you very much, Ahmad, and thank you, Professor Taisir, Professor Juma, and all other participants for this. Just to save time, now we can move to the next presentation, which will be about the AfroPHC policy framework, which was really like the cream of all the policy workshops that were held. As Mercy said, we held around 10 policy workshops in all parts of the health system, including financing, including research, including clinical aspects. And this really, this policy comes like a cream skimmed from all these workshops. And I would like to invite Dr. Jami Koloti, is a medical doctor from South Africa, and also a member of AfroPHC team led on clinical education and postgraduate diploma course development at AfroPHC to present. And I think before having this chance to Jami, if Mercy had any comments on what is said in these comments from all participants, you are welcome in 2 or 3 minutes.
Thank you so much, Al-Mughera. Jamie is taking minutes and will make a good summary of the comments and the challenges that we've had. But I think what I have really heard from most of the participants is the issue and the challenge of human resources. And I think that is very important, even as we are going to look at the policy framework, because it is around that, in terms of either the adequacy, the capacity, how they function, how they work, and as well the role. I had a lot about that. I think it was from Dr. Taisir, who mentioned the issue of, is PHC clear to everyone? Does everyone know what primary healthcare is, and what is my role within the primary healthcare system? I think those are very important challenges that need to be addressed. And also the issue of financing, I think, is cross-cutting in Africa and even around the world. There's just not enough. And when there's not enough, one of the places that suffer is primary healthcare, because everything ends up in the hospitals and there's very little left for primary healthcare activities, especially like prevention and promotion, as mentioned before. Other problems that I've had that are unique to the region that we've not had in other regional chapter consultations is the issue of political instability coming into play. And I like the example of the challenge that is in Sudan that even went to, apart from affecting service delivery in the primary healthcare centers, it also affected training and capacity building of the primary healthcare workforce. I think those are two very important challenges to note in the region. And Prof. Goma has also mentioned human condition, which I think could be related to maybe living conditions, the SDGs. Someone else has also mentioned economic burdens, people not having enough to take care of their needs and probably to pay for healthcare as well. So those are just some of the things that I have noted as challenges in the region. I like what Prof. Goma has mentioned in terms of we need more regional collaboration, especially in Africa. We need more collaboration between countries, collaboration regionally, because these challenges actually cut across. And if they cut across, then if people come together, then solutions can come up faster and can help more people. And with that, I hand back, I'll hand back over to you. Thank you.
Okay, thank you very much, Mercy, for these three comments. And now I would like to invite Jami for the next presentation. And also I would like to draw your attention to this very, very important presentation regarding the policy framework. It is like a summary for the policy framework. And I would like all the participants to be more attentive for this presentation, because we need your consultations. We need each and every comments from you in order to review and enrich this policy framework document before its endorsement. And we are in need of your oral opinion. So please feel free to add any comments, to criticize, to say what you want about this document, and we are happy with that, because we need this for the final endorsement of this document. Thank you. Jami, the floor is for you.
Thank you very much, Almagira, and thank you to Mercy as well for her presentation already earlier on. So as they said, I am Jamie Colity from South Africa, and I'll be presenting just a summary on the AfroPHC policy document. So as Mercy has mentioned, we were fortunate enough to win the PHC Performance Initiative micro grant. Let me just actually get to the presentation first. Can everyone see my screen? Let me just go slideshow. Use slideshow. There we go. Okay. So today I'd just like to be presenting the call to Africa. So it's a bit of a summary of our draft policy document. However, I would still like to encourage everyone to engage with the full document, and it's really helpful to receive everyone's comments. But hopefully today we can just run through a bit of a summary so that everyone can have a bit of a refresher if you have already seen the document. So AfroPHC's call to Africa is to join AfroPHC and build effective primary healthcare teams for universal health coverage in Africa. And basically, we'll be talking about heeding the call of African health professionals and recognizing African challenges and opportunities, as well as noting global PHC milestones. And the key elements of this call are to train, recruit, and maintain a sufficient frontline PHC workforce, as well as to support PHC with resources and build robust PHC systems. So the first that we're going to speak about is the PHC workforce. And here we speak about strengthening human resources for primary healthcare, where we call on Africa to build a larger, better trained PHC workforce with more opportunities, educational, financial, and clinical opportunities, and greater resources to enable PHC and UHC. We want to build the team with task sharing and supportive supervision. And for this, we call on Africa to acknowledge the burden on all cadres in PHC and embrace interdisciplinary teamwork with a mix of all health professionals using respectful task sharing and supportive supervision for achieving PHC and UHC in Africa. Furthermore, under the PHC workforce, we want to build distributed leadership. For this, we call on Africa to embrace distributed leadership practices and education for it amongst all PHC workers and managers to achieve PHC and UHC in Africa. We also want to build clinical governance, for which we call on Africa to embrace the important role of postgraduate trained family doctors in decentralized primary care settings to support clinical governance, coordinated care, and efficient referrals to achieve PHC and UHC in Africa. Furthermore, under PHC workforce, we want to professionalize community health workers. And for this, we call on Africa to standardize, professionalize, and decently remunerate community healthcare workers that are strongly integrated with the PHC team. And furthermore, to aspire to a target of 1 community health worker per 1,000 persons by the year 2040 in order to achieve PHC and UHC in Africa, as well as to manage human resources better. For this, we call on Africa to clarify and harmonize PHC workforce nomenclature for the different categories and disciplines in PHC, and to then embark on labor market analyses in PHC, including both the public and private, and specific PHC human resources for health policies, and strategic plans to scale up the PHC health workforce by the year 2025 to achieve PHC and UHC in Africa. Furthermore, under the PHC workforce, we want to develop human resources better. And for this, we call on Africa to implement a robust educational and credentialing infrastructure for developing a competent workforce dedicated to delivering comprehensive PHC services necessary to achieve universal health coverage in Africa. Then I'd like to discuss the aspects under primary healthcare resources. We want to view political and funding action for PHC as an investment. And for this, we call on Africa to regard health as an investment and to leverage political goodwill for action on PHC and UHC by defining PHC in budget terms, ring-fencing the financing of PHC, and committing to at least 2% of their GDP on PHC for universal health coverage in Africa. We also want us to fight for global solidarity action on PHC funding pools, for which we call on the world to re-examine global social solidarity on PHC and strengthen contributions to PHC for UHC in Africa as a priority, starting with high-income countries increasing donor aid to 2% of their health spend, and donor aid funds allocating 30% to an African Union funding pool for integrated PHC and UHC in Africa by the year 2030. Furthermore, under PHC resources, we want to manage pooled funds with strategic purchasing, for which we call on Africa to work towards better funded single pools for UHC funding, prioritizing strategic purchasing for PHC with standard and transparent contracting of both public and private providers in empowered decentralized units of PHC for universal health coverage in Africa. And we want reform PHC payment with blended capitation, for which we call on Africa to embrace simple national contracting of PHC teams with mixed or blended capitation models, including capitation, fee for service, and performance payments to achieve holistic and responsive PHC and UHC in Africa. Then under PHC systems, we want to embrace the biopsychosocial spiritual approach for PHC, for which we call on Africa to embrace the discipline of family medicine with its biopsychosocial spiritual approach to care to achieving PHC and UHC in Africa that is personalized, comprehensive, continuous, and coordinated in line with global standards. We also want to envision comprehensive person, family, and people-centered PHC, for which we call on Africa to embrace primary care, defined by the World Health Organization as an essential level of care that needs to be responsive, person, family, and people-centered, and covers the full spectrum of care within the paradigm of One Health for PHC and UHC in Africa. Furthermore, under PHC systems, we want health in all policies for robust PHC, for which we call on Africa to prioritize PHC as the foundation for UHC, making health in all policies an integrating and developmental public health approach to decentralized government, strengthening the role of PHC facilities with flexible models of non-hierarchical interdisciplinary teams, and creating integrated care models of public health service delivery of PHC and UHC in Africa. We also want to build quality in PHC, for which we call on Africa to embrace the culture of quality and patient safety with strong teamwork, and to measure and monitor performance to achieve quality PHC and UHC in Africa. Furthermore, under PHC systems, we want to build the district health system, for which we call on Africa to place their trust in their frontline PHC workers with decentralization of resources and the locus of control to bottom-up units of care, together with robust management functions to deliver an agreed-upon results and operational accountability to implement PHC and UHC in Africa. We also want to impanel defined populations to a defined team, for which we call on Africa to embrace the strategy of impanelment of a defined population and linking them to a defined, fully staffed and equipped PHC team as a foundational step to achieving PHC and UHC in Africa. Furthermore, under the systems, we want to develop community-orientated primary care for Africa, for which we call on Africa to embrace community-orientated primary care in community practices of 30,000 by the year 2025, and aspire to community practices of 10,000 for achieving PHC and UHC in Africa by the year 2040. The blueprint for rural and marginalized health, we call on Africa to embrace the blueprint for rural health and rural-proof all health policies to support rural and marginalized primary health care comprehensively, especially creating step-ladder entry requirements for educational institutions and rural or marginalized student immersion for the full PHC team to achieve PHC and UHC in Africa. And we also want innovative e-health that is patient and user-friendly, for which we call on Africa to embrace the variety of e-health solutions for PHC by ensuring that sustainable national e-health strategies are supported by accessible infrastructure, interoperability, and user-friendly designs that enable the PHC and patients and populations to enhance quality and support new models of care in PHC and UHC in Africa. So in summary, our call to Africa is, we call on Africa to empower and build an effective PHC team to achieve PHC and UHC in Africa. And we, as the African Forum for Primary Healthcare, commit to educating and empowering our members to support this goal in any way that we can. So a part of these consultations that we have within the different regions is to gauge feedback on the members. Oh, sorry, let me just stop my screen sharing. So part of our meeting today is to get feedback from members of the AfroPHC and our members who've joined us today from the different regions on the policy document. So if I can hand it back over to Al-Mughira.
Thank you. Thank you very much, very much, Jami, for this comprehensive and summary for the policy document for AfroPHC. And now the floors for all the participants from the Arabic chapter to add, to criticize, to comment, to add, to omit, to do everything you want to do regarding this policy document. And as I said, this was the cream of all the policy workshops that we held during the past year. And this is, I think, one of the main reasons why we are here today is to add to this document, to dissect it more and more and add. And as you see in this document, it also in all aspects of the health system, including the human resource, the information system, the governance, the financing, the healthcare service delivery, the models, even in details of financing regarding the method of payment. All these are recommended for all Africa. And when we say a call for Africa, we mean all the policymakers, the politicians, the ministries, all those in the side for decisions, for making decrees or declarations, and academia, and the researchers, all health professions, when we say call for Africa. So now the floors for you all, for all your comments, and we are open to downright or all you say. Ahmed, if you have any, you can lead the discussion. Ahmed Salam.
Thanks, dear colleague Dr. Al-Mughira, for the comments, and thanks, Jamie, for the presentation itself. I really appreciate if all of the participants give your comments, as Dr. Al-Mughira recommend, about this policy framework. Policy is one of the strongest documents. We would like to raise the concern about it. No one will improve the primary health care in Africa except us, the healthcare providers themselves. We need to think in different ways in terms of leadership, management, even the other, the health economics. We need to speak in different languages to be able to work with the multi-sectoral and convince the policymaker and decision maker in our local communities, and even in Africa itself as a region, as a continent, in African Union, to invest more in health generally and specifically in primary health care to promote the universal health coverage in Africa. It will be appreciated if all of you have the comments and what you would like to add more in this policy framework. And we can start with a simple question. Do you agree about this policy framework or no? I just need your answers. If you would like to open your microphone and even write in the chat box. Is this framework is good for you or no? I'm still inviting all of you, Rawia, Daniel, Grace, Ajero,
Yes.
Umneya, Professor Goma, Rania, Sakina, Sinkayar, Taysir. So please, yes, Rawia, please, you open your microphone. Please go ahead.
It is a great honor to me to start the discussion, but to me, I find the document very comprehensive, and it really covers a very important and strong the areas of defects in the health systems we are facing all globally and in the continent, in the African continent. And we can see that it addresses all the major areas. And to me, it is very satisfactory. Maybe if I go further in the detailed document that's shared by Mercy, we might think we might find some areas for improvement. But to me, this is perfect to me. And thank you very much. I appreciate the effort of all who work on this policy. What I like most is the health in all policy that is will cover and will that addressing the health in all policy concept. This will expand the area of attaching the health in the policy framework for and improving the health in for Africa. Thank you very much. I think.
Thanks, Rawia, for your valuable comments. Totally agree with you. Health in all policy, it's a very crucial point. And again, no one in other sectors will consider the health in their policies without our speaking up and raise the importance of that in a different language. Thanks again, Rawia, for your valuable comments. Any other comments, any other recommendation from our dear participants? Let us check the chat box. I think we have Professor Goma said that yes, we agree. Please, Professor Goma, please, if you would like to explain more why you agree on that policy framework, what are the most valuable or important pillars or points in that policy framework? It will be appreciated. Omnia Hassan mentioned that the framework is good and comprehensive and need a roadmap for starting. Omnia, why you said that the framework is good? What is the most valuable point you touched in this framework? Please raise it in the chat box or open your microphone and raise it.
Okay.
Yes.
Thank you. It needs the framework is comprehensive because it covers most of the important areas that we really suffer in our countries regarding the primary health care and needs policy reforming. For example, in Sudan, we need some of the reforming to the available policies so that we can improve the work in the primary health care. And this can be in some areas, it needs a roadmap on the directions we would like to go. And how we can involve more the community, because without involving the community, I think we'll be doing policies and it will be staying in our desks without being implemented properly. For example, I can give you a very little example from a practical work we have been doing in one of our states in Sudan, in South Kordofan. The people there, they have a purchasing problem and they have a problem of money availability. So they don't prefer to go to the health center for being given care and medical provisions. So when we asked them, why are you? They said, we don't have money. How are we going to go and pay for the health center? Then we asked them, what do you have else in can? For example, they have they cultivate maize, wheat, and other cash crops. So we told them that, okay, we need to improve our health center, which is your center. You are the one benefiting from it. So each one can get with a small packet of what available in their cash as a payment for the service. And then the health center will take all this and sell them at the market, and they will get money that will help in getting drugs, medical equipment, and even pay for the medical cadres available at the health center. That's why I said that the community involvement is very important. And I don't know how we can involve it in the closed policy framework, but I can see from the chat box that Professor Juma said the community mobilization can work, which is one of the most important tools that we need to strengthen the policy framework with, because communities are really eager to work for their health and for their well-being. Because if you have a health center that is just 10 or 15 or even 100 meters from your home. It is better than going and walking for more than 13 or 14 hours to get to ask for medical care, which is in some areas we view that they are increasing the mortality, especially maternal mortality, especially in the availability of reproductive health services and antenatal care and even postnatal care. Some of the women die in the road asking for the nearest health center that can give them a medical care. And this center will not be the primary health, it will be the secondary, and it will be in very remote areas. That's why community involvement and community mobilization is one of the tools that I think we need to find a way how we can incorporate it into the policy framework. Thank you very much.
Thank you so much, Umnia, for raising this very clear and very honest and very true examples and explanation of the power of community engagement in improving the primary healthcare system in our local communities is a very, very crucial issue. Decentralized empowerment for not only the healthcare provider, but train the healthcare provider to increase the community engagement itself. I think it's a very valid point, and it's need a multi-sectoral approach. This is our role as a healthcare provider, to speak with the other sectors, to raise the awareness. Policy in health and all policies, really we need to walk the talk and spread the awareness. We need to empower our communities, local communities, to be engaged and find some solutions and valuable, valid, reliable solutions to our local community. Again, thank you so much, Umnia, for raising that challenges and also solutions on that. Any other comments, any other recommendations to be added in the framework, or any modifications from your point of view? I think we have in the chat box, we have Sakina said absolutely, and I think she said absolutely agree about the framework. Please, Sakina, mention why you said absolutely agree to this framework. What's the most major points or pillars in this framework you would like to said absolutely on that? And then Professor Roma explained why she agreed on this framework. She said we have to put our hands together to strengthen the healthcare system. We have to add the value of collaboration that the framework itself are raised. The opportunity to use it, is all the world are supporting the PHC and UHC, universal health coverage. We have to move from talking to actions, yes, definitely, and take actions, as we discussed, valid, reliable actions to our local communities as well. All categories of the community, not only the health team or policy makers. Men involvement is crucial. Influence personal can help us. Thank you so much, Professor Goma, for raising this very valid points to take this policy framework beyond its theoretical framework. We still have a few minutes if you would like to add any comments, any recommendations as well. And I would like to give the floor to my dear colleague, Dr. Al-Mughira, and Mercy as well. Thank you.
Okay, thank you, Ahmed, and you call for Sakina and Juma to participate. So we are waiting, Sakina and Prof. Juma. Please, Sakina, unmute yourself and the floor for yours. Yeah.
Thank you very much for organizing this event. It's very important to discuss about primary healthcare in Africa. All the points it's very important to discuss, and I would like just to add about the language. The language is very important because sometimes, for example, the doctors here in Algeria speak French, and in the other countries, most of other countries in Africa speak English. So the language we use to communicate between doctors is very important. I think it's very important to focus on one language to make easy the communication between doctors and transferring the knowledge between them. Thank you.
Thank you very much, Sakina, for this point. And I think we already put this into consideration. And we know that especially this region, our region, Arab region, because we have different language. We speak Arabic, speak English, and also speak French. We know that Morocco, Tunisia, and Algeria, most people there are talking in French and other in Arabic. And so, but all these are there. And you see, AfroPHC now involve all these languages, including also Portuguese. For this in areas like in some countries in Eastern Africa, and really we are in need of this diversity. So these are included. Thank you, and thank you.
Perhaps I can just say, Dr. Al-Mughira, I can just say a few words. On that score.
Okay, Professor Shabir.
I've been listening, and it's been very interesting, and I'm really pleased that people find the document worth, being something that speaks to them. I think it is a very difficult document to read. You can imagine how difficult it was to write. I think trying to capture everybody's thinking in a way that's easy to understand, and relatively complex ideas, to put it all together has been quite difficult. And I think we still want reflection to continue. And I think that the points that have been raised, in some ways, this one that was been mentioned, I thought, let me just come in there because it's something that we haven't spelled out too clearly in the process, is that we have made a call for cases. This discussion is in a way to say what it says as a document. Does it speak to us in all parts of Africa? And it's great that it does. In addition to that, we want to get you to put forward cases. So cases of successful interdisciplinary teamwork in Africa in primary care would be really important. And we want cases to come from all over Africa so that people can see that this is not just some part only of Africa. It's speaking to all over the show. Then in terms of languages, we are going to have the funds and hopefully have the time to get the final document after we've gone through all these discussions to actually get different language versions, which will cover Africa. So English, French, Portuguese, Arabic, our expectations of 4 different language versions of a final document that is, you might say, going to be formatted, so it'll be a professional job done. We've got the money to do that, so we'll do a proper job. And then from there, it's an idea to now use that to get action, to say all over Africa, this is what we've said and agreed to, and we want you to now start making it happen. So I think this is just a first step in the process. If we can think these ideas through and share it as a very strongly owned African frontline worker, frontline stakeholder document, I think we can get a lot of attention and get these various stakeholders to, in fact, start doing something. And we want that to be happening at a local level. Obviously, we want to have a launch workshop in December with high-level WHO people. But from there, we need to get WHO, Afro, countries, government, officials involved in these discussions using this document as a guideline, so that you then can sit down with your colleagues and we are hoping from this particular forum, being a Arab Africa forum, that you pull a team together that will then be able to take the next steps using this shared document as a lever. So you can pull in a country like Tunisia or in Sudan. What we want to do is we want to encourage, we have got the kind of relationships for the country office of the WHO to actually help WHO, help AfroPHC to bring key stakeholders together and to create a forum locally. But we want that to be a step-by-step approach. So we are going to go there. First step is for us to come together in this Arab Africa group. And from there, you can then plan, you know, how it goes down to country level to create a AfroPHC in Sudan or an AfroPHC in Tunisia or wherever, Morocco, whatever. So I think, but it needs strong guidance, because these are ideas that we need to share, and then we need to use them to make sure we don't have confusion along the way, and that we get the best outcome using our collective minds. So I hope that helps the last person who spoke. I didn't quite get the name, but I think we do want this to not be just a paper exercise. And it'll ultimately, like Ahmed has said, will be a thing that we will make happen when we see results using the strong guidance which we're creating together. Jazakallah khair. Thank you.
Thank you very much, Professor Shabir, for this nice comments. And I would like also to invite Professor Juma, because she had some comment, need more clarification and more shedding of lights on what she said on the chat box.
I think she's not been able to speak throughout the meeting. That's why she's posting on the chat.
Ah, okay.
Yes, yeah.
Thank you. Ahmed Salam, now it's time for you.
Thanks, dear colleague, Dr. Al-Mughira, for that, and thanks, Professor Shapir, for the very valid, inspired, and comment. This is the time to work together, and we have much challenges, but at least we start to think together for our solution. If you can't, we should, all of us, be a part of a solution, not only a part of the problem as well. We still have, I think, 7 minutes. If anyone has any comments, any recommendation before we close up the session, please go ahead. And Mercy, the floor is yours as well.
Thank you so much, Ahmed. I think for me, it's just to ask everyone to continue the conversation. We still have the WhatsApp group. You can join that, and any other thoughts or comments that you have after, you can direct them to that group. And Ahmed and Al-Mughira will make sure that those comments are collected and they get to Prof. Shabir for consideration to add on to the document. And also to ask if anyone is interested in forming the interim regional task team for Arabic Africa. You can speak up now, or later on you can reach out to either Ahmed or Al-Mughira, so that we can have a team that can help with future activities, even as we are trying to set up structures. So if you're interested in taking up leadership and helping Ahmed and Al-Mughira coordinate things at regional level, please go ahead and speak up now, or even later on, just reach out.
If I may also just remind, on the front page, in a way that's very easy to get to, you can go directly to the document itself in a shared Google format, and you can write your own comments and look at it more closely and make suggestions. So it's very, very open. I just go to afrophc.org, and you'll find on the front, right in front, will be that access to that document, and you can then proceed to do that. And then there's obviously the WhatsApp group, and I think, as Mercy said, we really want people to come forward and to try and help organize at a regional level. Thank you.
Okay, over back to our facilitators as we bring this very it has been quite a fruitful discussion to an end, but it's not ending. Hopefully it will continue. Back to you, Almogira. I think you can
Thank
take
you very
like
much.
any last comments, and then we can close up.
Thank you very much, Professor Shabir. Thank you very much, Mercy, Jami, and Ahmed. Thank you all participants for making this event fruitful and interactive. And one comment I can close with it is that we have to be close together in this forum and in this chapter in order to put all our challenges in one side and to discuss it and to have a continuous discussion on these issues. And also I would remind you again, as Professor Shabir said, you have to also visit our site frequently to see the updates there, and also to add to the policy framework document. Don't forget www.afrophc.org, and you will find the site there, and you will find everything regarding new events or updates of AfroPHC. Again, I would like to appreciate with great deal this participation today from around 20 members from our region, and looking forward to seeing you in all our events and in the chapter and in Africa in general. Thank you very much.
Thank you all. Are we closed?
Yes, thank you very much, everyone.
Thank you. Take care.
Thank you so much. Thank you for everyone. It was very, very fruitful. Wish you all the best. Thank you so much.
Thank you.
Thank
everyone.
you. Goodbye.
Thank you for all of you, and keep in touch.
Thank you, everyone. Bye.
Thank you very much. Thank you.
Of course, we'll keep in touch. Bye-bye.